Hey there, it's Monica Brooks, and welcome back to the podcast. I am so excited to share today's interview with you. It's with my friend, Dr. Allison, who is a physical therapist, and she focuses on pelvic floor therapy, among other things. But I learned so much in this podcast. I learned so much that I cannot wait to share it with you. And if you're a man listening to this thinking like, I don't want to listen to this about the pelvic floor, uh, no, this information is for you as well, not just because we touch on men's health, but I think it's also important for men to know what is happening in a woman's body. She's going to talk about what is the pelvic floor, what is the mind body connection to the pelvic floor, but also how can we feel empowered over our health and what we learned today. So, if you're ready, let's get started. Welcome to the Becoming a Better You podcast. My name is Monica Brooks, and I'm a self-improvement enthusiast who is eager to share tips and strategies to help you become the best version of yourself. As an inspirational speaker who transitioned from a corporate career, I'm here to guide you on your journey towards enhancing your overall human experience. If you're ready to take the first step towards becoming the best version of yourself, then you're in the right place. Let's get started. Welcome, Allison, to the podcast. I'm so excited to have you here. Why don't you do a quick introduction about who you are and what you do?
I am Dr. Allison Ingley. I am a pelvic floor physical therapist. I have been a PT since 2010. So we are coming up on my 15-year anniversary, which sounds wild to me. And then I have been doing pelvic PT for 14 of those 15 years. I've worked in a hospital-based system for 10 of those years. And then in COVID, I ended up starting my own private practice. So I have a practice down here in Powell, Ohio. And I work on basically any adult pelvis, cisgendered men, cisgendered women, non-binary, transgender people, all adult pelvises. I do not treat pediatrics. I refer those out to the great pediatric PTs that we have in our area. But basically I work with anything that's going on there. So that's going to be anybody who's experiencing pelvic pain, whether it be provoked or unprovoked. So there are some people who have pain with touch or penetration. There are some people who have pain just at rest. They can't wear underwear, they can't wear tight clothing, or it hurts to go for walks or just try to live normal life. I work with people who have bowel and bladder issues. So maybe they feel like they're constantly having to go to the bathroom, or they feel like they go to the bathroom, but they don't get relief afterwards, or they feel like it's like they're sitting there, they're trying to go, and they can't initiate it, they can't get it to come out at all. So that would be like your constipation or incomplete bladder emptying. And sometimes we'll see chronic UTIs with that sort of situation. I work with anybody who's experiencing prolapse or diastasis, whether it's pregnancy induced or not. And then I work with all pregnancy, postpartum care, preconception care, all that kind of stuff, just to kind of help the body get ready for baby and then be pregnant and then prepare for the birth and the labor and birth process, and then that postpartum period of recovery. So I handle kind of anything from basically anything in that whole midsection is all me.
Yeah, that's pretty incredible. And I was like, can you help women who can't jump on a trampoline?
Yes. Yes. And you know what is so funny? So my first 5 years of practice were in Dayton, and I did treat pelvic PT in Dayton. And when I came to Columbus, and I always ask patients, what's your goal? And they would always say, like, I want to be able to jump on the trampoline with my kids. And I'm like, what is this trampoline epidemic happening in Columbus, Ohio? Because the first 5 years of my life, I don't know if they just didn't have trampolines in Dayton, if people weren't linking or they didn't care about it. But I came to Columbus, and I swear, I'm like 50% of the patients I would work with, they were like, I just want to be able to jump on a trampoline with my kids. And I was
That
like,
is funny. So, okay, what year did you come to Columbus again? What year was that?
2015.
Oh, okay. Because I was going to say 2020 was a big, let's get a trampoline. We're home, the
Yes.
pandemic. So I wasn't sure if it was
Yes.
around that time. Okay. Okay.
Yeah.
So one of the reasons I wanted to bring you on the podcast was to talk about health. And I feel that when we become educated or
Mhm.
when someone shares knowledge with us, then we feel empowered to make decisions over our lives and to seek help and to bring that conversation up. So you don't have to be uncomfortable or be in pain. You should never feel that way.
Mhm.
I would imagine you don't want to feel that way. So, what are some typical things that you just wish people were more aware of?
Yeah. I think the biggest thing for me is that there is an acceptance specifically among the birthing population that having kids will lead to these problems, and that it's just this is normal, this is what's accepted, and that it's perfectly fine because my mom and my sister and my friends, they all dealt with this, and it's just not the case. Unfortunately, we have a long, and I don't want to go too far on the deep end of this one, but like OBGYN in general has a pretty rough background, um, in general. It's very, very racist, very patriarchal, kind of setting the foundation for a lot of medical gaslighting towards birthing people. That this is because a lot of these physicians were men at the beginning. All of them were men at the beginning. They didn't have the body parts. They didn't know what was going on. They were just working on other people's body parts, and they were like, "Nope, this is normal. This is fine." And it's like, but it's kind of not. So it did take a lot of like, honestly, a much more compassionate group of physicians. I think the current group of physicians that we're seeing these days are a lot more interested in preventative care, a lot more interested in collaborative care. So we're seeing that kind of turn from sort of that bit of a god complex of like owning somebody else's health to like really building more autonomy in that. So I think there is some education coming out now and a lot more collaboration with the physicians, and just the medical community in general. But in general, I just wish people knew being pregnant, like birthing a child is not a reason to suffer from pain, leakage, prolapse, things like that anymore. And then also the other thing that I really struggle with is that um, there's actually like a surprising lack of care for like men with pelvic pain and urgency. It's like if men are experiencing sexual dysfunction, they're like, oh, we'll do anything we can to help you. But if they're experiencing other symptoms like bladder issues and or bowel issues or pelvic pain, it's almost like if it's not an infection with the bladder or the prostate, we don't know what it is. And therefore, we're just going to give you more antibiotics, more antifungal creams, and they cause more problems when really many times it's a musculoskeletal issue, it's a neurological issue happening in the pelvic floor in the same way that it would happen with a woman. So, overactive muscles pinching on nerves, causing a lot of problems, and it's all stuff that can be treated. So, I just tell people like, we just don't need to accept that there's things
Yeah.
going wrong here. That's just not what this is anymore. Like we need to have comfortable conversations. We need to say the body parts. We need to talk about what's going on. Because like if you were having like chronic sinus infection, you wouldn't just be like, oh well, this is how it is. Like, no, you would get treatment for that.
Yeah, and I feel what you're saying is that used to be okay, maybe a standard of care way back when, but really even wasn't okay back then. But now we need to talk about it. And when we talk about pelvic health, we're not just talking about women. See, I already I didn't know that. I have so many questions. Let me back up.
Yeah.
Okay, pelvic floor, in the simplest of terms, tell me what a pelvic floor really is.
Yes. So your pelvic floor is a group of muscles that all work together. They go from your pubic bone in the front, underneath and around the genitalia, back to the tailbone. So some of the muscles, based on the orientation or how they're directed, some of them are going to, they're all going to work together to do the same things. But some of them are like around your urethra to close that so you don't leak urine. And then when you go to empty, they open up so that you can empty urine. Other ones kind of help support the pelvic organs or support your tailbone or your sacrum within the pelvis. They help transfer momentum and force through the body. They're there for sexual function. For example, when you have an orgasm, they twitch at about a contraction every like 0.8 seconds. So it's not a conscious contraction, it's an automatic contraction, reflexive contraction. And they're twitching like that around the sex organs to like during that orgasmic state. And so they have a bunch of different functions, but basically that's the general area, your saddle region when you're sitting, that's all pelvic floor. So if you're sitting and you can feel your like butt bones, it's going to be everything on the inside of those butt bones that is muscular.
Okay, so pelvic floor is the group of muscles that's down there.
Mhm.
That's kind of like doing all this work with
Mhm.
our pelvic organs. Did I
Yes.
say that
So
right?
we have the
Okay.
pelvic floor here, and then the organs are going to be more on top of that.
Okay, got it. I don't think anyone has ever explained it to me like that.
Yeah.
When do you feel like people should be taught about the pelvic floor and the importance of the muscles in there? Like I mentioned, I didn't get educated on any of this, so a lot of it came just with experience when I didn't realize there was a solution to the issues I was having. So, like,
Yeah.
when should we learn about this kind of stuff?
I think we should be learning at a very, very young age. Like, I think when you're teaching your kids, this is your arm, this is your nose, this is your chin, this is your foot, we should also be teaching this is your vagina, this is your penis, this is your anus, this is your perineum. We need to get comfortable with those terms because
Hmm.
when you do, it makes sex ed, like the puberty side of sex ed, a much easier conversation to have, where you can then educate your girls on their anatomy, what a period's going to look like, right?
Yeah.
You can educate your boys on what does a period look like? How
I
can you
just did
support?
that. Yeah,
Yes.
my son is 9, and we just talked about that.
Yeah.
Like what happens
Hmm.
and how he can support a woman or a
Yes.
girl during that time because I don't
Yes.
want him to go into this like, oh, that's gross or
No.
disgusting, and he doesn't know what to do. So it was a very open conversation. And he was like,
Yeah.
oh, okay.
Yeah.
Because I want him to know, and I want him to also feel empowered when
Hmm.
a girl has her period and things that he can do. So I love that you mentioned it because I kind of felt weird when I was having the conversation. Like there's always that, oh, is this too young? But no, if he
No.
shows a curiosity towards one thing, then well, let's have the conversation.
Absolutely. Absolutely. So the way that we do like sex ed in our house is basically in fourth grade, I talk to them about like I get out the anatomy books and we talk about these are your parts and pieces. And then we talk about these are the opposite sex's parts and pieces. And just so they have an understanding of what is where. We also talk about like I need to empty my bladder. We don't say I need to go pee. They understand where their things are coming out of. They know what organs are there. And so, like, my daughter was 3 years old, and I told her to go take a shower, and she was super, super tired at the moment. And so she was like, do I need to wash my hair? Yes, you need to wash your hair. Do I need to wash my arms? Yes, you need to wash your arms. Do I need to wash my belly? Yes, you need to wash your belly. She goes, I need to wash my vulva. Yes, you need to wash your vulva. And she goes, Mommy, vulva's on the outside, vagina's on the inside. I'm like, yes, that's right. And she goes, do I need to wash my bottom? And she just kept going. It's like, yes, like we are speaking about these organs just as we
Yeah,
would anything else.
yeah.
And my boys, like I have two older boys, they're 15 and 12, and they absolutely know what periods look like. We have that conversation where like even like I for a while there was really struggling with some pretty hard mood management, mood irregularity in that week before. And I even have to sit down and talk with them and say, listen, guys, my period's getting ready to start in a week. My hormones are doing some pretty crazy stuff right now. If I say anything that seems excessively mean to you, let me promise you, I do not mean it. I am not being serious. None of what I say right now is accurate. I am working with the doctor to make this a less significant situation. But when I tell you that I need my space today, I'm just going
Yeah.
to need you to trust me that I am not the best version of mom right now. And I don't want my issues impacting you. And so we can have that conversation and they can say, like, this isn't really my mom right now. She's going through some stuff. And then we can kind of just go our separate ways and kind of exist in the space without really ticking people off. But I think that we need to start having conversations at a much younger age on what the genitalia are, how the parts and pieces work. And then in fifth grade, we talk about with sex ed with them is we say, like, okay, this is a reminder of these are your parts and pieces. This is what the other side's parts and pieces are. And this is how babies are made. So the sperm has to start here. And I get out little like videos of like microscopic sperm going to the egg. The egg starts here, the sperm starts here. The sperm has to get to the egg, and the egg has to live in the uterus to be able to make a baby. So how is this going to get over here? And so they
Hmm.
have an understanding of this is the path that it's going to take. And then they're able to figure out, like, oh, the penis has to go into the vagina so that the sperm can get up through the cervix into the uterus. And that way they kind of understand that process. And so it's a very open conversation so that they can kind of put the pieces together. And it's not a traumatizing situation. And we always just say, like, at any point in time, if you want to stop talking about this, we can, but they usually
Yeah.
have more questions.
Yeah, I think that's great to normalize having the conversation, saying the words. I was very shy growing up. Like I did not like puberty. I held a lot of shame around it. Like I
Mhm.
didn't want to be looked at. I didn't want to be like, I didn't want to wear a bra. Like I just tried to cover myself up as much as possible. And so I honestly kind of feel that way now. Like I don't like talking about periods. I don't like that. To me, that's too much information, although it's normal. Like I guess the question is, why do you think there's so much shame and maybe that's not the right word, but just shyness around these topics?
It is usually shame, because again, we have to. I don't know what your background was. I don't know what your upbringing was like, but many, many, many people here in the US, especially people that I work with, grew up in conservative Christian environments where it's kind of a don't touch it, don't look at it, don't let anybody else look at it, don't let anybody else touch it. Now go put on a white dress and now go sleep with your husband and have a baby. It's like, wait, what? Like
Mhm.
it's too rapid of a thing here. And there's not a lot of conversations. Like we are kind of the first generation of people who are talking about this regularly. So we didn't grow up with it. So there is kind of that like, you do have to kind of dip your toes in and slowly kind of go into it here, that. And I work with a lot of people who have kind of come from a purity culture background and they're having severe pelvic pain that they did not know existed until after they got married and they tried to have sex and they couldn't because they didn't connect the dots that they couldn't ever use a tampon before. They were just like, oh, tampons hurt, so I'm just going to use pads. And that was, they were kind of like left on their own to figure that out. And so it never really became an issue until they were expected to start producing children and they can't have sex. And so for some of these people, like they don't even know what their parts and pieces are. And so we will start off with simply what is your comfort level with looking at your own vagina? And if they are comfortable with it, I'll get them on the table. We'll sit them up. We'll get a mirror out and we'll kind of describe, okay, this is the labia. This is the clitoris. And we'll go through the different parts and pieces. Some people are like, absolutely not. I cannot even do that. It's like, okay, what's your comfort level with looking at a medical drawing of that? Right. And if
Mhm.
that's where somewhere where they're comfortable, then that's where we start. If it's somebody who's like, I cannot touch my own area. Like I can wipe when I go to the bathroom, but that's it. Using an internal menstrual product, that sounds terrible. Masturbation completely off the table. Absolutely not. It's like, okay, can we desensitize ourselves to the point that we can rest our hand on top of our vulva, on top of our pants and underwear? Just get
Mm.
comfortable with that, Can we rest
Mhm.
our hands without underwear on our upper thighs? So we're just kind of basically like slowly integrating touch and visual and naming the parts. And then once we start feeling more comfortable with that, then what does it feel like to touch some of these internal structures? If you were to put a tampon in and you had to open the labia up to put a tampon in, can we kind of understand that? Because the nervous system is on such high alert that if we don't treat it nicely, all it's going to do is reinforce anxiety signaling to the pelvic floor. And what's really interesting about the pelvic floor, there's a really interesting study that was done a million years ago, but I don't think anything has changed. I've not seen anything come out to discredit it. And it basically, they hooked a whole bunch of women up to surface electrodes and they showed them different images, mundane images, and then physically and violently sexually threatening images. And they said, we just want to see what does the body physically do when exposed to different input. Obviously, the mundane images elicited no response. The threatening images elicited three muscle groups that tighten up at the exact same time: jaw, upper traps, so ears to shoulders, and pelvic floor. So the pelvic floor
Mm.
clenched up at times of stress. So if we're sitting here trying to allow for any sort of penetration, whether it be personal hygiene, medical, intimacy, and we are anxious about that, the pelvic floor just tightens up in response. And so then now it's painful. And then now we're trying to grit our teeth and bear it and push through. And now we keep reinforcing pain and anxiety signaling where we keep getting the same output. So we have to treat the nervous system very gently, get the nervous system to calm down with exposure before we start trying to do anything like that.
I feel like I could end the podcast here and be like, I have learned so much and we're good.
It is a little bit mind blowing of
It
like what all
is.
can be done and how our body interprets life.
Well, I think we spend so much time on the physical aspect that people can
Yeah.
see, right?
Yes.
Makeup,
Hmm.
hair,
Hmm.
working on exercise. That feels good on the inside, but also on the outside, we see the reward of that.
Right. Right.
And this podcast is called Becoming a Better You.
Hmm.
How do you think learning about this and your pelvic floor, how do you feel this could help men and women feel
Oh my
empowered?
gosh. So much. Oh my gosh. Okay. This is like probably my favorite question so far. So going back to that recent study that I just talked about. Okay. So basically, what a lot of things that I do is I kind of specialize in chronic pain or chronic symptoms. That's kind of my area of expertise, along with like the pregnancy postpartum side of things. Okay. So when I'm working with people with chronic symptoms, your pelvic floor and your deep core system will tell you so much if you learn how to listen to it. But so many people are disconnected to it, either because they have pain and that's the only way they can survive is just to dissociate, or because they grew up in an environment where there was shame associated with it, or they perceived shame was associated with it, right? So sometimes parents can have the best intentions in the world, but if they don't actively try to make it comfortable, then you might perceive that it's a shameful thing simply because what you hear from school and from other parents. And so we are who we are. We were on whatever journey we were on, and we are here now, and we have the issues we have. So the way that I like to do it is I first start people off with what I call tension checks, where every 2 hours, no matter what you're doing, I have you tune into your body and just let go of whatever you can let go of in about 5 seconds, okay, without changing your posture. Okay, so for example, if I was like lounging on a chair watching a movie or something like that, and my legs were crossed, and I did my tension check, and my top leg kind of flopped to the ground, well, no, my body needed that tension to hold the leg there. That tension was fine. But if I was gripping my abs and I let go of my abs and I'm still sitting in the same position, then that was too much ab clenching that I didn't need, right? So it's not a posture check, it's just a tension check. Then, after we get really comfortable with that, because a lot of times people will be like, oh my gosh, I clench my abs, I clench my glutes, I clench my toes. Really interesting. The nerve root that goes to your pelvic floor is the same nerve roots that go to your calves and your feet. So there's a lot of symptoms that kind of overlap there, just as a fun side note.
Interesting.
Mm-hmm. And so we start off with that. Then we take it to the next level of like, okay, how can we relax different things in our body? So, like, I will walk people through an elevated tension check, is what I call it. So, instead of relaxing just the main big stuff, now we're going into like, can you relax your rectum, your sacrum, your uterus, your prostate? So, like, getting really deep into these connections in the body of like, can I elicit change there? Because if you go to relax, like, I've had people where I'm touching their pelvic floor and I'm like, okay, now relax the space between your eyebrows. And I feel their pelvic floor go because they're so holding so much anxiety tension in their face that when they relax from here in the area that's not threatening up in their face, the whole anxiety response relaxes. And then we build that into how do we physically process emotions? So basically, an emotion is basically we have a thought that leads to a chemical recipe of feeling in our body, and that is the emotion. And anybody, you ask anybody, like, what does it feel like in your body to be angry? And they probably know. What does it feel like when you're terrified? They probably have a feeling associated with that. And so we can start to then use this to physically process emotions in the body so that we can say, like, okay, so, for example, if I'm working with somebody with pain and I have my finger placed at their vaginal opening and they're like, okay, oh, like, and they're like really nervous. I'm like, okay, I'm not moving anywhere. I'm going to stay right here. But I want you to tell me what is happening in your body, not at your pelvic floor, anywhere else. And they'll be able to tell me, like, oh, I feel like there's bricks on my chest, or I feel like there's something clenching like a fist clenching my stomach. And then we focus on that sensation instead because it's the emotional response. The pelvic floor is usually fine. And when we get that emotional response, they breathe through it, they give it space to exist, then all of a sudden now they're like, oh, it doesn't feel like it. Are you still there? Like, yeah, I'm still there. I haven't moved at all. And because the pain wasn't coming from the pelvic floor, it was coming from the anxiety response. So then we reverse engineer this in life. We say, okay, when you are in that meeting with your boss that you can't stand, tune into your pelvic floor because you know anxiety for you personally leads to these types of things. Let's go ahead, instead of just stimulating the pain at the pelvic floor, let's catch it before it becomes a symptom again. So now we can say, like, oh, I'm feeling really escalated. Let me tune into the areas of my body that usually tense up. And now we can keep our pain from becoming this huge thing once we've brought ourselves back into ourselves and we can start reading the signals that our body's sending us.
I I just can't believe all of this. And it's because I've always found it fascinating how our body responds in a chemical kind of way with our emotions and our hormones without us even always realizing it. And like you mentioned, taking in an image and clenching up, we don't even realize that that's happening. And our pelvic floor is involved in that, and even our shoulders. And you said that jaw was the other one, right?
Yep.
That
Yep. So
that's
I would say a
Go ahead.
lot of people I work with have TMJ dysfunction, so temporomandibular joint dysfunction, and pelvic floor dysfunction, or chronic migraines and pelvic floor dysfunction. They tend to go pretty well together because they're kind of anxiety induced.
When you talk about working with patients, how like, I don't know if there's a percentage of how many are just really uncomfortable with this. I mean, clearly they had to take the step to want to see
Yeah.
you and want to get help, but how many walk through that door that are just like scared because they don't know what to expect?
Yeah. I have kind of like three different categories. I have the people who are like, I am a lot of times like the third, fourth, fifth PT that somebody has seen because they're like, I keep being told that I need to go to pelvic PT. I've done it a million times. It hasn't changed anything. And it's like, that's probably because they were focusing only on the musculoskeletal components versus the whole system. So I have people who are like, I've been through it. I'm ready to go. I'm perfectly fine with it, but just make it stop hurting. Then I have the people who are like, do whatever you got to do to get me out of this, but they're so fearful and anxiety, like anxious about the symptoms they're experiencing and what those symptoms mean. And like, is it going to be like this the rest of my life? So they're super escalated from that anxiety state of like, what does this mean for me? And then I have that other category of like, this is so weird. I don't know what, like, I don't even know what to expect. I'm really scared. I don't think I can do this, but the doctor told me I needed to come in, or my friend told me I needed to come in, or I was reading your website and I feel like this is the right thing, but like this is kind of icky and I don't really want to talk about it. And I don't really want to do it. And I'm not sure that I can. And so, like, I always tell people, like, I have a patient right now, for example, who we've been working together for probably 3 months and have yet to actually get undressed. And she's
Hmm.
making progress because she is not at a place yet to be doing an internal pelvic floor exam. And that's okay because that just means we have more work on the nervous system to calm down the nervous system and allow it to be tolerant because it does us no good to grit your teeth and bear it. It just is like the worst possible thing that you could do when it comes to having an overactive pelvic floor.
At what point would you recommend to come see you? Like, when is it like, all right, it's time?
I would say that once you have been cleared of any medical cause for the symptoms that you're experiencing, right? So it's like if you're having urinary urgency and it's been 24 hours of urinary urgency, I'm probably not your first call. It's probably to a doctor to make sure that we don't have a UTI, to make sure we don't have some sort of a yeast infection or something else that might be causing some symptoms, right? So like, but once you have been cleared medically, where they're like organs look good, there's no infections, we don't really know, then I would say, yes, that's a me thing.
Our healthcare system is currently set up to get sick and then go see a doctor.
Mhm.
How does that work with your pelvic floor? Is this something that people can come to at any point to be preventative in some way? Like, do you
Mhm.
see patients? Like, tell me more about
Mhm.
that.
Yeah. So I actually in some of my professional groups, they actually are very, very pro preventative care. Come in once a year for a pelvic floor exam. Let's make sure that all of your stuff looks the right way and is working the right way. And if we're finding any areas of deficit that we think could be a problem down the line, we're going to give you a couple of things to work on that. And sometimes it's a one and done type of evaluation. Sometimes it's like an evaluation and then maybe a session or two to address those couple things that could be a foundational issue. I am perfectly fine doing that as well. Columbus, Ohio doesn't seem to be quite as proactive of other areas in the country. You know, California is a very proactive health environment, like the West Coast is in general.
Mhm.
But yes, I think that just like you go to see your PCP to get your lab work done every year, I think that there's absolutely no reason we should not be seeing some sort of physical therapist every year. And if you're somebody who has a background where you think you might be at risk for pelvic symptoms, then seeing a pelvic PT and just doing a general like, hey, is my body moving the way that it should be moving? And if it's not, what kind of things can I incorporate into my daily life to make sure that it is moving the way that it should be moving? And
Mhm.
then keep moving on with your life for the next year.
Is there anything you wanted to bring up or talk about that you didn't have a chance to, that I haven't asked a question about?
When it comes to Kegels or pelvic floor contractions, I know that's like all the rage, and I love that because it was like nothing 10 years ago when I was, doing this. But here's what I would say: 40% of this study was only done on women, but 40% of women do pelvic floor contractions or Kegels. It's the same thing. 40% of people do it wrong. 25% of those people do it in a way that makes their problem worse. And so, please, 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 like there is that whole like, use the muscles that you would use to stop the flow of urine when you're going to the bathroom. Please don't do that. Or at least don't do it more than once a month because I do have people who have actually trained the reflex of their bladder not to empty all the way because every time they've gone to the bathroom, they've tried to stop the flow of urine to work on their pelvic floor strength. and then it actually messes up with your emptying. So if you're somebody who does that like once a month to make sure you're getting the right muscles is not going to cause a problem. That's perfectly fine. But if you're doing pelvic floor contractions and your symptoms are getting worse, please stop because you may be dealing with an overactive pelvic floor. Because an overactive pelvic floor is one that's kind of holding on like a clenched fist. And when you ask it to do more, it can't give you more, right? An underactive pelvic floor is what most people think they have, where it's just kind of laying there, not doing a whole lot. The problem is that you can have the same symptoms in both overactive and underactive pelvic floors, but the treatments are going to be completely different.
That's a great point because I think sometimes when we hear an idea, we're like, oh, I'm going to try that. But your body isn't the same as somebody else's.
Right.
And so if you saw a pelvic floor physical therapist, they would be able to tell you
Hmm.
what's going on in there and to
Right.
know what steps to take. So
Right.
be careful always of the information that you take in. I would say
Yes.
even the podcast, do your own fact checking. Do you know
Yep.
what I mean? Like go research it, go find out, go talk to your doctor, talk to physical therapists on what's best for you. What do you think makes a good physical therapist or like maybe even questions they could ask to make sure they're in the right
Yes.
hands?
Number one, you want to make sure that they've taken all of their level courses. So they've taken their pelvic floor level 1, 2A, 2B, and C, or capstone. They're called different things, but you want to make sure that they've taken the basic medical knowledge side of things because a lot of kind of like mill clinics will send their PTs to like the level 1 and now they can say we treat pelvic PT and they will end up getting people who have pain issues, bowel issues, complex medical issues, but that's not
Mm.
covered in that course. I used to teach that course. I know what's covered in that course, and it's not enough to handle complex stuff, right? So get somebody, if you're complex, that has all 4 of those levels. And then the other thing that you're really looking for is somebody who has been trained in trauma informed care. You
Mm.
need somebody who's going to be making sure that the environment is set up for your success, not necessarily their success. And so
Mhm.
making sure that you have somebody who has trauma informed care training is really important, especially if you're a pain client or a like a traumatic postpartum type of situation.
Okay.
For me, those are very important.
I'm so glad I asked that question because I just learned so much. And I think
Yeah.
sometimes we get hung up on the credentials, like, oh, look, yeah, we can do this, but experience matters and the right training matters as well. So, Allison, thank you so much. This has been incredible. I have learned so much from you, and I'm so
Yeah.
glad that we've met. And I'm so glad I can call you my friend also. Like,
Yes.
this is so great. So, next up, though, in the next few months, we're going to be interviewing Dr. Stephanie. And
I
yeah, so I have to get
love
that
Steph.
scheduled. I know she's great. So it'll kind of like tie into her role as
Yes.
well. And
Yes.
my hope is that through all of this information, the more information we have, the better we can make informed decisions and the more empowered we can feel in life. And as a result, become a better version of ourselves. So that is it for today. Thank you again, Allison, for joining us. And I will list all of your links in the description notes.
Thank you so much. I appreciate you having me.
All right. Bye.
Bye.